Gonna talk about a person called Ebstein. Kidding. Ebstein anomaly. Ebstein anomaly consists of downward displacement of an abnormal tricuspid valve into the right ventricle. So, like normally we are expecting a atrioventricular valve to be present exactly in between the atria and the ventricle. But what happens here is that the tricuspid valve is going to displace downwards, and instead of being present at the junction between the right atrium and the right ventricle, it's mostly inside the right ventricle itself. Normally, what we expect is this tricuspid valve, which is normal valve, okay. When a tricuspid valve is normal, it has three leaflets. There's A, P, S or SAP, okay, SAP. SAP stands for septal, anterior and posterior. So three leaflets. Fixed end of these leaflets is attached to a valve ring in a tricuspid area. So this is normal. But what happens in Ebstein anomaly? The tricuspid valve is in an abnormal position, and the abnormal position required tricuspid valve itself is abnormal. The anterior leaflet is attached to the valve ring as normal, but the posterior and the septal leaflets are displaced downwards and they are attached to the wall of the left ventricle. So the SAP இருக்கு பாத்தியா? SAP, the septal, anterior and the posterior one. Anterior alone is attached to the ring, valve ring, but septal and the posterior ones are attached to the wall of the left ventricle. The portion of the left ventricle above the tricuspid valve becomes a part of the right atrium. So it's called like the atrialization of the right ventricle, just like testicular feminization, unfavorable lionization. There is atrialization of the right ventricle. The right ventricle is becoming a girl. Kidding. Okay, the right ventricle is becoming the atria. That's what I meant. Hemodynamics of this disease. The tricuspid valve anomaly results in obstruction of the blood flow as well as regurgitation of the blood flow from the right ventricle into the right atrium. So dilation and hypertrophy of the right atrium due to volume overload. Blood flows through the from the right atrium to the left atrium through a patterned foramen ovale or ASD. Right to left shunt and cyanosis occurs. So this is only Ebstein's anomaly, okay? So because the tricuspid valve is screwed up, okay, because it is screwed up, the blood which is supposed to go from RA to RV does not go. And instead, there will be regurgitation of blood from RV to RA. So there is dilatation and hypertrophy of the right atrium. Now the right atrium has a lot of pressure. It tries to release the pressure, overcome the pressure through the pattern foramen ovale or an atrioseptal defect. Through that, it's going to give the blood to the left atrium. So it's a right to left shunt. It's a real lies, okay? So real is RL. So right to left. Lie is blue in color. So cyanosis. Clinical manifestations, cyanosis. That's like the main clinical feature. Cyanosis, fatigue, dyspnea on exertion, paroxysmal attacks of tachycardia. Dyspnea on exertion, paroxysmal attacks of tachycardia, and fatigue. Signs are there, okay. Cyanosis clubbing, main sign. JV peeler, dominant V wave. There is a systolic thrill on the left sternal border, okay. And S1 is normal, S2 wide split but variable. Wide fixed split is seen in ASD. Wide variable split of S2 is seen in Ebstein anomaly. Right ventricular S3, right atrial S4, systolic murmur due to regurgitation at the tricuspid valve, delayed diastolic murmur due to obstruction at the tricuspid valve like tricuspid stenosis. So, okay. So both the systolic and the diastolic murmur produced at the tricuspid valve have scratchy character like pericardial friction rub. Patients with Ebstein anomaly may have accessory conduction pathway causing WPW syndrome. X-ray showing box-shaped heart is due to enlargement of the right atrium and seen in Ebstein anomaly. Okay. So signs pataka, pickle, cyanosis and clubbing will be there. JVP JVP, right? The V is the dominant V wave is present on the JVP. Apart from that, S1 is normal. S2 there is a wide variable split. S3 right ventricular. S4 right atrial is also heard. Systolic murmur also heard. Diastolic murmur also heard. Systolic murmur is due to regurgitation at the tricuspid valve. Delayed diastolic murmur is due to obstruction at the tricuspid valve.